want to address Mariah's question also, and just maybe talk about some things that could be helpful for you too, Chantel.
Kirstin, just so you know, Mariah's son is in the 1st grade. She just texted me. He's 7 years old and he's been diagnosed right now with ADHD.
Okay. So with ADHD as well, kind of very similarly to autism, what I would recommend is, I can't stress enough how important these neuropsychological evaluations are. I'm biased because that's really the heart of what I do at this point, but really what a neuropsychological evaluation will provide is this really comprehensive look at your child across these various domains. And I think most importantly, we're getting a really good sense from all of this testing what the areas of challenge are. But I think probably more importantly, we're also getting a really good sense of what that individual's strengths are. And we can really kind of use those strengths to kind of bolster intervention and really kind of shape services and supports. And so getting this really comprehensive view of strengths and weaknesses and really understanding, the neurocognitive kind of nuances, we're really able to take that objective data and really map it onto educational planning, IEP development, making sure that kids are making progress within expected timeframes. We're also able to map this information really closely onto, obviously, our diagnostic impressions and also treatment planning and medication planning.
And so, a question for you, Dr. Birtwell, in regards to I'm assuming neuropsychological testing is the same as we have psychoeducational testing or assessments here.
Likely, yeah. It might include a couple more domains. And just call me Kirstin, by the way.
Okay, Kirstin, sorry.
Yeah.
Liam just had another one completed. I had pushed because we're moving where we're moving to. He's not going to continue into grade 7 in an elementary school system. He's going to be going up into junior high. So there's a big leap in what his services might be. So I'd really pushed through our school district, and he just had one completed. And I can't say how much I appreciate, like, how much knowledge even I myself as a layperson, as a mom to him, get out of the results from that testing. How often do you recommend having it done?
So I would say typically we recommend every 2 to 3 years.
Okay.
We have a lot of patients that are not making good developmental progress. I actually see a lot of patients with seizure disorders. And so tracking their developmental progress is particularly important with regard to their neurocognitive functioning. And so there are some patients where every year might be more appropriate. And unfortunately, sometimes it's also driven by insurance coverage, which might be better for you there than it is for us here.
I don't know. Yeah, it's hard to say.
I know.
It's all tricky when it comes to this stuff.
I know. Yeah. But yeah, I on average, we say every 2 to 3 years would probably be standard. And I think from what I'm gathering from Liam's profile is that would probably be appropriate.
Yeah, I was kind of thinking that because junior high where he's going is going to be grade 7, 8. So we've just had one done in grade 6 leading us into junior high. And I was wondering at what point do I start pushing the new school district we're going into to have another one done before he heads into high school. So we have the best assessment of his cognitive skills, his social skills, and his academic capabilities as we're heading really into that next level of his schooling. So
so
that's a great answer for me.
Let me back up and explain this too for Maria. Sure. So when I talk about neuropsychological evaluation, I think what I might be talking about is extending on that psychoeducational evaluation a little bit more. And so this is something that is done largely privately here.
Okay.
And insurance will cover it for most of our patients, for the far majority of our patients, actually, to some capacity. But so a neuropsychological evaluation is likely taking, the psychoeducational evaluation and just extending it and including a couple other areas of focus or a couple other areas of assessment. Okay. And that would be, things that would be included. So a psychoeducational assessment might just include things like intellectual testing or cognitive testing and academic testing. And that is something that here is done every 3 years through, or at least in Massachusetts and my experience with most other states as well, every 3 years through the special education system. And so that's called like a core eval. And so that would include a psychoeducational evaluation, and that would also include, as needed, if it's indicated that this is, or if it's requested by the parent, or if it's indicated by the team that it would be necessary, a speech and language evaluation, an occupational evaluation. And it can also include things like an FBA, which is a functional behavior assessment. That's really specific to guiding kind of ABA services and behavioral programming for, particularly for individuals with autism, but also for ADHD. And so that's the distinction there. A neuropsychological evaluation would include everything that I listed here. So cognitive testing would include information on attention and kind of sustained attention and executive functioning. Are you, and Chantel, you're familiar with executive functioning?
Mm-hmm.
Okay.
Yeah.
Also language domains, visual motor skills, fine motor skills, learning and memory, adaptive functioning, and obviously kind of social, behavioral, and emotional domains. And so the neuropsychological testing battery is really kind of specifically tailored to that individual child and what they're presenting with and what the referral question might be. So yeah, I would say to do that every few years. And just circling back to Mariah's initial question, the neuropsychological evaluation is often the kind of strongest, I guess, tool in the advocacy tool belt, because you're really getting, again, this kind of third-party expert opinion about what the needs are of the child. And what the neuropsychological report will entail, often they're upwards of 20 pages. You get a lot of information about all the tests that were done, and you get this summary of kind of, the psychologist or the neuropsychologist would really be pulling it all together. And then at the end, you get a recommendation section, which is really this kind of list-like, collection of almost like a roadmap of where to go from there. And oftentimes in my reports, if I have like a, maybe a 15-page report, I would say maybe like 3 or 4 pages of that would be the recommendation section. It's really, really comprehensive. And it would really be tackling, based on all of this really nice data that we have, what are we recommending in terms of home services? Are we recommending in terms of, potentially parent support? Educational programming is obviously a huge, huge part of that. And then all of these kind of care collaboration pieces. The hope would be that the neuropsychological evaluation is so, again, kind of comprehensive that it would really include all of this and tie everything together. So Chantel, I think it's really great to hear you say that your pediatrician is serving this really great role as like the hub provider. Mm-hmm. Within our clinic, the neuropsychologists work really closely with the MDs, and the MDs are typically the hub providers. But I would say the neuropsychological evaluations have been so helpful for so many of our patients. They kind of look to us as almost that kind of hub provider, because everything is kind of coming back down to that mm-hmm. neuropsychological profile. Because when we think about what services would be like, so when I started the presentation, I really wanted to talk a lot about this whole idea of heterogeneity within autism. And really what that means is, there's a saying by Hans Asperger's that if you've met someone with autism, you've met like one person with autism or one person with Asperger's. And, when we think about that, I don't often think about placing patients on that kind of linear spectrum, but if we think about that spectrum, it's just really quite wide. Mm-hmm. And so the kind of nuanced there's not this kind of prescriptive blanket recommendation for kids with autism in regards to social programming, in outpatient services, anything like that. And so it's very, very individualized. And the neuropsychological evaluation can really provide that individual profile to kind of guide treatment and inform programming across settings, if that makes sense.